Hello, and welcome to the symplr Education Series webcast. Today's webcast is titled Checklist for Payor Enrollment Success, an Overview, with Donna Gessencore and Dina Solis. At the end of this session, we will have time for a formal Q&A, but feel free to ask any questions as they come to mind via the chat box located on the right side of your screen. You will also be able to download the archive of today's webcast and its slides at symplr.com soon, and will receive download information in an email. This webcast is brought to you today by symplr, Team Med Global, the Texas Society for Medical Services Specialists, and MSD, Medical Service Professional. We are so pleased to have Donna and Dina as our speakers this month. I'm sure many of you know them, and I'd like to turn it over to Donna now.
Great, thank you, Callie. Greetings today from the rainy but beautiful state of Washington. It's a pleasure to have been asked by symplr to present on the topic of payor enrollment once again. The industry certainly has had a lot of attention on this topic, and that focused thought will continue due to the importance of enrolling practitioners onto the various government and commercial health plans. The more quickly MSs can get practitioners credentialed, enrolled, and onboarded, the more quickly the payment for services will be received, and those efforts keep everyone happy. As Callie had mentioned, my name is Donna Gessencore, and I'm just one of your speaker team today. Hello, everyone. That's me on your screen. My co-presenter and one of my technical knowledge sources on the topic of enrollment is Dina Solis. Dina, how about a greeting to our guests with your usual touch of class?
Thank you, Donna. As always, it's always a pleasure to work with Donna, and I'm very happy and very honored to be asked to co-present again on the topic of payor enrollment. And I hope that everyone enjoys the presentation and can take home some good information and tips that we're going to share.
This Part 1 webcast is being presented to our listeners truly as an overview of the refresher of the very successful series that Dina and I presented early last year. In preparation for today's program, Dina and I reviewed all of the content from our 4-part series last year and compressed it and updated it to bring to you today a program that provides for each of you a checklist of sorts, a summary of relevant principles that are essential in every effective enrollment program. In addition, we'll offer tips for you on how to reduce reimbursement delays, and then, with whatever time remains, we'll answer your questions. And to further add to the value of this series, Dina and I will answer your additional questions that may come to us, but we really just don't have time to answer at the end of this program. So via a post-program Q&A report, be on the lookout for that, again, as one of the value-added takeaways by your attendance in today's session. As I mentioned, today's session is really a refresher in training. For those of you who may have joined Dina and I previously, but persons or new attendees this time around, Dina and I are going to present to you information about payor enrollment that's introductory in nature, but it really is providing to all of our enrollment specialists a framework on better understanding payor enrollment. And it really truly begins with that framework and what your process is going to be. The process that we're going to help provide for you by use of this visual checklist is give you that definition of what enrollment really means, the types of enrollment, understanding that there's a two-step process in enrollment, that there are specific attachments to that enrollment application that are required as part of that enrollment double check that you're going to do. And then what I'm calling, and Dina really is calling, a tip sheet. So all of the different tips and strategies that we're offering through this webinar and Part 2 series next month, please understand that this visual framework is really, again, helping provide that structure to you, because there's lots of moving parts, just like credentialing. When we have to verify credentials, there's lots of moving parts in enrollment application as well. So one of the strengths that I know I possess, and Dina has really enhanced that, is creating that structure for you to walk through, and when you're explaining that process to a potential new employee or to better understand it yourself, it's been categorized for you. So let's start with our checklist, right? And go with, what does enrollment really mean? And enrollment is the process of applying to health insurance plans and various networks. So those physicians or practitioners or providers are included to those healthcare panels. So billing and payment for the services that are offered are indeed provided to that specific practitioner or healthcare worker. There are 3 types, truly, of enrollment that I think will help us as the presenters, as well as you as our listeners, understand. So when you're managing various applications, you can kind of put these in your mental buckets. We're talking about all of the federal and state programs, specifically Medicare and Medicaid. There will be enrollment applications specifically related to those 2 sections of enrollment. And then we're talking about another key category, and this one here is probably the one that people are most familiar with, and regardless of whether you're working with a federal or a state program or a private and commercial plan, there are nuances that are naturally part of that application process for these 2 categories. So for private and commercial, the examples that we've provided would be the Blue Crosses and Blue Shields and Aetnas and United Healthcares, and there's many, many other insurance carriers, but in this regard, we're giving you these examples to kind of frame it for you. And then the last type of payer enrollment applications would be those under workman's compensation. So there may be, again, some commercial carriers that would be appropriately aligned to workman's compensation, but the acronym before you is the U.S. Department of Labor. And those would be federal employees and retired employees of the government that would fall under this category. So understanding now the definition and the 3 core types of enrollment applications or categories, let's really break this down. And the visual that you're going to see has been branded and really created to help aid the education and the understanding of enrollment, and that's been provided by Dina and myself through this series of webinars we've done. So this 2-step process, very simply, is the pre-enrollment process of payer enrollment, and then the post-enrollment process. And to provide us the drill down of what those steps include, I'm going to ask Dina to take it from here. Dina?
Thank you, Donna. Okay, so now that we have the very first step is to determine which plans that you want to that you're enrolling in. The second step then would be to collect the provider information and documents. The third step is to obtain, complete, and submit the application. And the fourth step is to follow up until determination is made. So digging a little bit deeper into step one, this is, you would be, depending on your organization or your group, you, excuse me, you may be asked to enroll in certain plans, or you may be asked to research what plans are popular in your area. And so if you need to research which plans are popular in your area, there's a resource called the Atlantic Information Systems Directory of U.S. Health Plans that is very helpful, and I can give more information on that later. But if you go to the AIS website, there are different media types that you can purchase that have the Directory of U.S. Health Plans on it. They sell, it's sold in hardbound in a book format and also on CD-ROM. And then what I do is, in step one, is to go to each payer's website for information on what that payer might, if there might any type of specific instructions or any specific applications. Sometimes it's pre-application, sometimes payers have an application right on their website. So really just going to the payer's website, you can call provider enrollment or provider relations to get information. And this is something that I always do. Even when I think that I know everything about a certain payer, I always call their provider enrollment or the relations line just to make sure that I have the most current information. So going on to within the step one, over the years I've learned a core group of questions to ask when I call payer enrollment. And usually these tips on specific questions to ask will be very helpful and actually help reduce enrollment delays, because you can get your information up front ahead of time. So I usually ask if there's any special type of requirements or licensing required, depending on your provider, depending on your state. There could be, as Donna said, there could be nuances, there could be certain steps that are required before even requesting to become enrolled. I also ask what the typical time frame is for processing, because as we all know in this business, it varies greatly by payer. I also ask what their preferred submission method is. Sometimes it's pretty clear cut on the payer's website. It's an enrollment. They might use CAQH. Of course, the larger payers, I'm sure they use CAQH, but some payers may not. It could be very cut and dry. Some payers will give you an option if you want. So if that's the case, then I always ask for a street address versus a post office box. Usually applications will say to mail to a PO box, but so that you can reduce enrollment. And then also, obviously, if the payer accepts or uses CAQH is a question that I would ask.
So all of those tips, Dina, really relate to our step one, which is determining which plans to enroll in.
Right, right.
Gotcha.
And getting the information before you start your process. This is something that I do for all of my clients. And
we even have more.
I'm sure, yes, we always have more questions. So other tips on what you can ask when you're calling enrollment is if the payer permits backdating. And so this I've run into when my clients are interested in going into a new market and they are not quite familiar with what's required. They may have to get a special license. They may have to complete some lengthy prior authorization paperwork, or processes, and so I normally ask if the payer permits backdating, and if so, how far back would they go? It varies by payer. Others can go back as far as the Medicare effective date. Some payers will go back as far as a license effective date, and some payers will. So it's really, if I'm going into a new market where we don't know what those payer requirements are, then I ask. Okay, and then fee schedule. Sometimes this isn't always as clear-cut. State Medicaids usually have a fee schedule on their website, Medicare obviously, but there may be a private payer that doesn't have that fee schedule readily available, and it might be important to your provider to know ahead of time what certain codes pay for before you enroll, to determine if they even want to enroll with the payer. So I usually, depends on my clients, but there are certain codes that my clients like to know ahead of time what the rates are for those codes. So I usually ask for that. I also find that sometimes EFT, which is electronic funds transfer, electronic remittance advice, and electronic data interchange, that's those three acronyms. Sometimes those forms are not quite readily available on some payers' websites. So ahead of time, if I see that it's not easily locatable on the website, sometimes those forms have to be mailed or emailed or faxed. So I usually check that out ahead of time, and I ask at that time for that information. And then a word about out-of-state providers. So this is something that I've found for certain provider types. It may not always be true with every provider type, but certain states in terms of Medicaid do not allow out-of-state providers. Some states might allow an out-of-state provider, and it might be on, when I say primary versus crossover, this would be on the types of claims that they could submit and be reimbursed for. Some states only allow for out-of-state providers the provider to enroll as crossover to Medicare only. And unfortunately, I found this out the hard way. I have several national clients that I've enrolled in certain state Medicaids. Now this is kind of a little bit more for state Medicaids, but it could be, you could run into this with private payers as well. That some of the state Medicaids will only allow a provider who's located out of state to enroll in their program as crossover to Medicare only. So a provider would not be paid on any, if that patient has a primary, say, Medi-Cal as their primary insurance, an out-of-state provider trying to enroll in Medi-Cal, say from like a border state like Nevada, depending on how close they are to the border. But if they service patients who actually live in California, they may have run into trouble with being enrolled as an out-of-state provider. So that's something that I always try to find out ahead of time so I can let my providers know. And I ask if there's any special requirements for out-of-state providers, such as examples of that might be if there's a certain bond that's required, a certain agreement that there might be that the provider has to sign. I've even run into a special license. I've even run into some states requiring service locations in their state in order to be enrolled in a particular state Medicaid. So always good information to find out before you go down the lengthy road of enrolling your provider. Okay, moving on to step 2 is mirrors what I'm sure everyone does in credentialing, is collecting the provider information and documents. So this would be any pre-application that the provider might fill out, using their CAQH profile, getting their information from the NPI registry, or if your organization uses a repository such as the credentialing software, you would review and QA the information for completeness and accuracy. And you can One thing that I always do is double check their addresses, zip codes, and counties against the United States Post Office website. You can do go to their website and just type in zip+4 lookup and type in their address, and it will come up with their 9-digit zip code. And then also we always check names, addresses, and expiration dates on the licensures and supporting documents just to make sure it matches up with everything that's on their application. And then step 3, again, similar to credentialing elements, the enrollment application elements always include instructions, which are obviously, it's a no-brainer, but they are a great reference for a lot of very basic questions. The application also includes identifying information, education, and training. And it asks, they always ask for licensure, certifications, and affiliations. Of course, references and work history. Description and services that are provided. And it always asks for liability insurance information. And
I'm good. I'm sorry, go ahead, Dina.
I was going to say that sometimes you may be asked for liability information that retroactively. So payors may ask for, similar to credential CVO, a payer may want to know liability insurance information for, say, the last 2, 3, 4, 5 years.
One of the questions I was going to bring forward to the group is a question that I get a lot from the field. I will have credentialing professionals say, hey, Donna, really, what is enrollment? I mean, why are the people who are doing enrollment doing the same things that we're doing? And I think that that's an important distinction. So I'm going to ask a question to you, Dina, that you, again, for those individuals who may be on the phone who have done enrollment a long time, you clearly understand what that distinction is. But for those MSPs that are on the line who have been told by their administrators that they may be delegated the responsibility of being responsible for payer enrollment, but also those MSPs who maybe just want to have a better understanding of the responsibilities that the enrollment specialists have. Can you bottom line this for us, Dina? Is the greatest distinction by way of the credentialing component or the application component is that the credentialing specialist verifies the things on the application to substantiate that, yes, that practitioner attended this school, they have this board certification, they have evidence of this license, and what the enrollment specialist is doing is collecting all of these necessary documents that you see listed on the screen.
Right. Yes, I would agree with that, Donna.
All right, are we ready to move on?
I am definitely ready.
All right.
Okay, so other application elements that are typically asked for: billing information, clearinghouse, third-party administrator, if the provider uses any of that. There's typically attestation questions, ownership, control, interest disclosures, information release and acknowledgements. There's provider agreements and EFT agreements, and usually at the end of your application, there's a checklist of attachments to include. And this checklist of attachments, going on to the next slide, typically includes, similar to credentialing, it's all the applicable professional, medical, federal, state licensure, certifications, registrations, proof of tax ID number, usually a signed and dated IRS W-9, articles of incorporation. I've had partnership agreements asked for, proof of professional degree, fellowship and residency, any possibly a driver's license, any CE. I really haven't had CEUs asked for, but again, it could just depend on the payer. Professional and general liability, definitely, if they carry workers' comp. Typically with an EFT agreement, a voided check is required, and not all payers, but I have had California and New York ask me for copies of the provider's release agreement for their practice location. And then also you want to check and see if there's any type of application fee associated with your enrollment. Usually private payers are not so much application fees, but state and federal, I've seen that. And then moving on to step 4, you want to follow up until your determination is made. And this may seem like a no-brainer, but communication is definitely the key to reducing reimbursement delays, because it does take, sometimes you'll think that your application just goes into a black hole and nobody ever responds, which I get that all the time, but it really is important to follow up. And it's very important to respond promptly to any questions and any requests for more information. I really don't think I've ever had an enrollment fly through with a payer not coming back to ask me for something. If it's a clarification, if it might be information on what the services that the provider is providing. So it's always very important to respond to those promptly. And then also it's very important to give updates to your provider or your supervisor and make sure that they're logged into your credentialing software if you're using that type of technology. And if it's approved, you may need to ask for a letter, welcome letter, or a duplicate letter, because sometimes not all payers will send you an official welcome to our health plan or welcome to our Medicaid. Sometimes you have to ask for that. And then also part of following up until determination is made is the denial. If you're denied, I have kind of a whole little extra information that I'd like to go on to expand on in our next section, but you'd want to ask why, and then find out if there's a time that you can reapply. Sometimes payers will come back and say that their panel is full and come back and reapply in a few months. So moving on to post-enrollment. So we've wrapped up with what you do before the enrollment, and now post-enrollment, once you've completed your application process and you've submitted it and you are waiting. The first step is obviously, again, to obtain the proof of enrollment or denial. Implement it with your billing department. So if you've been approved, you would implement, if you can be helpful to your billing department by providing information about the payer's provider manual, or the provider numbers, the NPI, if that's effective dates, whatever you can be helpful with. I've had to work with billing departments to implement enrollments and contracts. Step 3, record and load the new enrollment and contract information into your database if necessary, if you're using a database. And then step 4 would be maintaining for continued enrollment, and that can include, I'll get into that in the next slide, but can just include just regular routine maintenance in the payer. So digging a little deeper on this post-enrollment process, step 1, obtaining proof of enrollment or denial. So I just want to expand a little bit on denials. One thing that can be helpful is, and when I get a denial and working with clients, I rarely take no for an answer. So I think that it's really important to understand that just because you get a denial letter doesn't mean that that the provider is absolutely denied. And what I mean by that is that sometimes the health plan or your payer may just need a little bit more information about what your provider does a little bit differently. Sometimes when I get a denial letter, I will send all the information again. Maybe I'll contact, I might contact who the contact information is in the denial letter. Sometimes it's helpful to connect with somebody on LinkedIn and try to find another meta payer, or you might already be connected with the payer somehow on LinkedIn. So a lot of times, and I'll query that health plan to see if I have any first degree or second degree connections that might be able to help get information. So sometimes there's more than one way to get enrolled, and it might just take a little bit extra digging or some extra work on your part. But there are some, I deny an out-of-state provider, and I've been able to work with their prior authorization department, maybe get a letter, something like that. So it's always good to try to not stop at the first denial letter. And that's my little extra tip on that. So step 2, post-enrollment, implement with your billing department. Like I said before, there may be something that you might be able to assist with setting up EFT, which is the electronic funds transfer, EDI, which is electronic billing, and I'm kind of speaking in terms of smaller groups or practices. There might be some steps that you can be helpful with, and then electronic remit advice, and that would be working with the billing department to see what their preferred method is, remittance advice. And then step 3, recording and loading new contracts in the database. So this could entail just getting executed copies of an agreement, a welcome letter, scanning it and making sure that it's in your database, and working with the payer to ensure that the provider is loaded into their network system. Sometimes that can be a whole separate process that doesn't go and flow as smoothly as you might think. So there may be there might be responsibilities that you might be asked.
Just recently, the government has created some type of a legislation or that the payors, the managed care or the payer, updated like within, is it in 30 days?
I am not sure exactly what the time frame is, but I do understand that they need to have very current provider directories. Yes.
Mm-hmm. Yes.
So.
Okay.
And then step 4, maintenance for continued enrollment. So this could be changes of information that you may need to report, any updates, any new licenses or insurance payer. There may be reattestations, revalidations. Some payers will enroll for a certain period of time, and then you that your licenses that is effective, but just being aware that there's an enrollment is completed. Many times, it's not like a one and done kind of thing. You really need to pay attention to each payer to make sure that, and loading this information in your system, if you use a software system, is very important as well. It can be very helpful in keeping on top of enrollments that might expire, a key in reducing any type of reimbursement delays or hiccups, making sure that you definitely don't want your providers' enrollments or provider numbers being deactivated because you might have missed a step there in post-enrollment. So this wraps up portion of our presentation, and I'll turn it back.
All right, so Dina and I are going to be much more collaborative during this portion because we really want to underscore how we can help you reduce delays pertinent to reimbursements. So let's first talk about beginning the enrollment process immediately upon collecting information or that application and documentation from that provider. So Dina, could you give us an example of what you're meaning by immediately?
Right. Well, I would consider this being part of the first process, the pre-enrollment process, that you can take steps finding out ahead of time, finding out which, making sure you know which plans, what that you are enrolling, sure that you know ahead of time what any special requirements might be, asking all of those questions ahead of time and getting information and being prepared ahead of time definitely helps reduce delays because you're better prepared. Making sure that you have all of the information that's typically asked for ahead of time definitely helps expedite that, the beginning part of that process.
Also helping to expedite